Now, Charlotte-based StarMed Healthcare is also sending its disaster response team to help with the ongoing medical needs in Western North Carolina.
Queen City News reporter Savannah Rudisill joining us now with a look at their new mobile clinic set up at a Banner Elk campground. Savannah.
Yeah, not exactly the most traditional spot for where we would see medical services being provided, but of course in disaster areas and after things like this, kind of happens wherever it can. And so a campground happens to have running water and power to help them out. So StarMed is behind the North Rapid Response Team. They've got this mobile clinic that's really there to fill some of those essential primary care and urgent care needs. Today's going to be the first full day, but the team leaders tell me that they were seeing patients just as soon as they got equipment up and running yesterday. Medical professionals say that they're still working on filling out the essential needs, things like getting people prescription, doing wellness physicals, flu shots, immunizations, just some of the basics. Now, while the setup at Grandfather RV is very mobile, very compact based on these pictures here, it still offers about 90% of treatments and services an established clinic has. That includes injury treatment, lab testing, even mental and behavioral health care. StarMed CEO and North Rapid Response founder Dr. Michael Estramante tells us that they have hundreds of qualified professionals ready to take on shifts in Banner Elk, but they're also still taking applications, especially from bilingual providers. He says there's a sense in the area that really the entire healthcare community is working together.
We recognize that, a month after the devastation that occurred, a lot of the immediate first responders that came in from a medical perspective, they were either getting fatigued, worn out, or they had to go back and do what they were doing before. And so we kind of said to ourselves, this is a good time to make sure during that gap when some organizations were pulling out, let's get in there and make sure. Western North Carolina was already having difficulties, challenges with access to healthcare to begin with before this happened. So we said, let's just get up there and see what we can do.
And it's going to be a while they see what they can do. It's going to take them a little while. They say maybe a couple of months is the projected timeline for right now, but that site is open 12 hours a day, 7 a.m. to 7 p.m. Walk-ins are welcome, but they do encourage anyone with internet connection to try to grab a spot online. That's on StarMed's website.
Savannah, we heard Dr. Estramante talk about the challenges that area faced even before Helene hit. What challenges are they up against now?
Well, Dr. Estramante was telling me that those challenges before, what he was referring to is that there's a lot of uninsured patients, a large number in some of our mountain communities, and especially some people who even might qualify for Medicaid. There aren't as many Medicaid providers in that area. So he says that being able to come in with an emergency response, provide those essential free services, is filling a gap that existed both before and after Helene.
All right, Savannah, thank you. And Queen City News wants also to remind you about ways that you can help other victims of Helene. You can scan that QR code right there on your screen. That'll take you to our website with multiple ways to donate. You can also find that information by typing in qcnews.com.